Hey Dennis, Jim contacted me about news of your retirement and asked for some thoughts. And I wanted to take advantage of the opportunity to provide you with some feedback on your performance. You've been at this MIS thing for some 20-ish years now, and you're well overdue for some form of evaluation. Now, it's not always easy to receive or, frankly, to deliver critical feedback, but just think of this as a constructive review. Now, I haven't had the chance to work with you as closely as many of your colleagues who know you even better than I do, but I have had the chance to interact with you on a regular basis on the national and the international stage, and I think your impact at this level is something that I can credibly attest to. Now, you were the guy that brought MIS to Halifax, bravely shining the laparoscope on the promise of minimally invasive surgery. I think it goes without saying that being an excellent clinician, surgical technician, teacher, and educator are expected attributes of an academic surgeon, although you might want to talk to your parents about your ongoing need to excel in all those areas. I've encountered many residents and former fellows of yours who express such a strong affinity and appreciation for your mentorship that I can only suggest you might want to back off a little. Quite honestly, it's making the rest of us look bad. I'm also aware that above and beyond the call of duty, not only did you bring MIS to your patients, your local colleagues, and your program trainees, but because of your passion for minimally invasive surgery, you also put considerable effort into training regional surgeons in laparoscopic techniques. This, I think, can best be simply described as showboating. We all have limited resources, and you're making it look like you bought a bucket of bandwidth at Costco. Just something to think about. From a professional aspect, we've had the chance to get together on a regular basis at a wide range of academic events and professional associations with which you affiliate. You've been a regular contributor and a leader in too many areas to enumerate, and you are always the guy that's not afraid to speak up and call bullshit when the discussion has lost its way. The politeness of that language aside, that aspect is appreciated by many, tolerated by some, I guess, but there are worse things than being credible and clear-spoken. I say this because you can't fix a problem unless you know about it, so there. I guess the last area that we really need to cover is the social perspective, and it's here that I really have some concern. Now, when you and I have the opportunity to network over a beverage, a really, really tiny hamburger-like thing, or even a pineapple skewer, it should be understood that this is your chance, like the rest of us, to complain and suck the energy out of the room. And I sense that you did not get that memo. You're always the guy that has a funny story and an amusing anecdote or an inside scoop that, quite frankly, makes people want to seek you out, come and talk to you, invite you to dinner. I think it's important to realize that this is not in keeping with the official policy, and it runs a high risk of improving collegiality. Again, a bad place to finish, but just something that I think you should be thinking about. So I think that covers the main points of the evaluation that I wanted to get at. Now, you might think that a performance review from halfway across the country is of limited value. However, I see more of you than many of the medical students for which I have delinquent evaluations, so I think you need to take what you can get. Dennis, I have a heaviness in my heart for you, my friend. Take care of yourself and your family.